anybody ever weighed? What's that?
Can you repeat the question?
If you had a lab scenario and it said you're going to measure knee range of motion and test strength of the knee, how would you screen this patient? What's that? Okay, that's good. Can you extend your leg? Great. Okay, so what do we just established? It does what? And? Awesome.
Well, you don't want to say extend, right?
It straightens and bends in layman's terms. Okay, that's so we would ask, can you straighten your leg out for me? Right? Can you relax and bend it back?
Or kick forward.
Yep. So now we do that. Can you do that on your other side also? Great. Okay. So with that screening, we know that we have something to measure. What do we also know about the muscles?
Strong enough to resist.
Probably strong enough to resist. So we're what grades can we eliminate? 0, 0, 1, and 2. So that's why it's helpful to do a screening, because it should already start kind of your mind turning about what we have to do when we go to muscle testing. You know, now if she could only do this, we would still measure that range of motion, but what are we thinking? What grades can we eliminate? 3, 4, and 5. Okay? What other grades can we eliminate?
0.
And 1. There you go. So, you know, always, that's why it's good to screen, because it's kind of like triaging. So yes, we make you in this class demonstrate all grades, but in practice, that's why you would screen, so you don't have to, you know, it would be a waste of time to go and do all 5 grades when you don't need to. Remember, we have that Dr. Professor Rubio, is that doctor yet?
Not yet.
Not
It's
yet.
gonna be.
Okay, soon, doctor in training. She was saying that, you know, you get just X number of minutes to do your eval, and so, you know, time management. So screening, think of it as a time management tool also. All right, so we've established that. Now I'm going to measure her range of motion. So I would like you, do you have a leg that bothers you? Both? All right, so it doesn't matter. Your right side? All right, I'm going to measure your good side first, then we'll compare it to your other side. So what I'd like you to do is lie down on your back with your head up this way, feet down that way, so layman's terms. And then what I'm going to do is just, for flexion, I'm going to evaluate the resting position by lining my goniometer up. At the axis point would be the lateral epicondyle of the femur, and then the stationary is going to go to the greater trochanter, and the, put you up, this is still plugged in, good. So I get a better sight line here. And the movable will be to the lateral malleolus, and she is right at 0. So what I'd like you to do is bend your leg up as far as you can. Is that all you got? All right. So now we have to reestablish those points here, here, and here, and get a measurement. And I have 145. So extend. Now, what I need you to do is, let me see if we can get these enough here. For extension, we have the table in the way, and oftentimes legs can extend a little bit better than that. Can you lift your leg up for me? All right, back down. All right, now straighten your leg as far as you can. You may have to go up one more. These are wimpy towels. So lift up again. Okay. All right. Now straighten. Yeah, let's go to it. So Clarkson recommends you put a towel under the thigh so that you can see if we can go. Many of you may go beyond 0 degrees. Now we call that hyperextension, because extension is to 0 degrees. Beyond that is hyperextension. So we're going to see if she has any of that, or is she just at 0. So I'm gonna get my landmarks here. Now for this one, it's gonna be a very short arc. For this measurement, you can probably put your goniometer on the landmarks and have them move, because the range of motion will be small. All right, now if you could straighten your leg as straight as you can get it, and that's it. She just goes to 0. She's not gonna go any farther than that. So she does not have any hyperextension. So what is her range of motion? So extension, she goes, so you would actually say, what was her endpoint of flexion? Okay, 145, so her extension is from 145 to 0, and her flexion is from 145, so her range of motion is 145. All right, now, if you would you sit back up for me? So we've already established that she is at least a 3, so I'm gonna apply resistance. So again, just like the hip, she's gonna stabilize by grabbing onto the table. So go ahead and grab onto the table. What I'm going to do is I'm going to stabilize the pelvis, and she's going to extend her leg out. Now, if you remember in, especially relax, with these, in my lecture about manual muscle testing, where does a muscle create its greatest torque? The beginning, the middle, or the end of a range? The middle. So you don't want to have somebody go all the way out. You want to have them extend. We want to do that to establish that there are 3. But to do a brake test, we're going to kind of put them here. Don't let me push you down. Are you ready? Hold. 1, 2, 3. And so she did not break, so that would be a 5. If she broke, it would be a 4. All right, very good. Now, I will also show you the 0, 1, and 2. It's pretty easy. 0 and or 1, you would be palpating the quad muscle and looking for or palpating for a flicker. So we have more than that. And if nothing happened, it would be a 0. So I will show you the 2 position, but I'm going to show you kind of like I did with the hip, what you would do for both flexion and extension. So if you would, lie on your side and just come back toward me. Okay, okay. I'm going to use the leg that's available for me. So remember, for the hip, relax, we had the knee bent and we guided it and supported it and to see if she could go from extension to flexion and from flexion to extension. So for the knee, what we're going to do is support the lower part of the leg, relax, and the upper part of the leg. Can you straighten your leg out? So I'm not pushing it out, I'm just supporting it to see if she can do that. So that would be for extension. Now can you bend it, pull it back toward me? That would be for flexion. So that's your 2 position for both extension and flexion. Now we're going to test, if you could lie prone for me. So I would tell her, lie on your stomach, please. For the hamstrings are going to flex the knee. So against gravity, can you bring your leg up toward the ceiling? Okay, and back down. So that's at least a 3. Now we have a couple different hamstrings here that we're going to be testing, a medial and a lateral group. To test them all together, it's called an aggregate of them. We're going to go up, so you can see she could bend way up. We're not going to test here, we're not going to test way up here, we're going to test about that midpoint. And what you have to do is a couple of things. Now, it depends on how long your arms are, so I'll probably show you a short arm way. You have to stabilize the pelvis. I think Clarkson shows you strap them to a table. The ADA frowns on that, so we're not gonna strap anybody to a table. So you do have to stabilize the pelvis. And what you're going to do is then hold there, don't let me push you down, hold, 1, 2, 3. So it's usually easier to push than pull. And so she was able to hold. So for all hamstrings, that would be a grade of 5. If she gave, it would be a grade of 4. But oftentimes, especially when people injure a hamstring, they're going to injure not all of them, but on one side or the other. So how do we differentiate? Who remembers their muscle anatomy? When a lateral hamstring flexes, it can also do what? Biceps femoris flexes the knee and externally rotates the tibia when the knee is flexed. And the medial hamstrings can flex the knee and medially rotate the tibia when the knee is flexed. So that's how you differentiate. So what I'm going to do is take and have her turn her foot out, hold there, don't let me push you down, hold, hold, 1, 2, 3, she can. So that was the lateral hamstring group to isolate that. And now turn your foot in as far as you can. And hold there, don't let me push you down, hold, 1, 2, 3, and she can hold there. That would be the medial hamstring group. Now, Clarkson does not differentiate between medial and lateral hamstring when you do a 2. So you would just do what I showed you earlier as a 2. So they do differentiate between 3, 4, and 5 between lateral and medial hamstring groups. And of course, if we were looking for a 1, we would look for something in the hamstring groups here, flickering. And if nothing is happening, it's a 0. So we'll start with the knee. It's pretty straightforward. We're going to measure flexion and extension. We're going to muscle test flexion and extension. The only thing with flexion is you get to do hamstrings as a group and then isolate lateral, medial hamstrings. It's pretty easy. Turn out for lateral, in for medial. All right, so try that. And